Hello friends, our today's topic is endodontic emergencies. Endodontic emergencies are those procedural errors that occur during the endodontic treatment. Endodontic emergency can occur in new beginners or students, but it can also occur in case of skilled endodontists. So endodontic emergency can occur at different stage. First, it can be related to excess opening. Second, it can be related to canal shaping and cleaning. Third, it can be related to obturation. So we will discuss it one by one. First, the endodontic emergency related to excess opening. Emergency condition related to excess opening. During excess opening, different type of emergency condition can occur. First is treatment of wrong teeth. If the diagnosis is not proper and if the clinician is not skilled enough to diagnose the correct tooth, then in those cases they may treat the wrong tooth. So the treatment of wrong tooth, the diagnosis, how can you prevent it? The diagnosis should be proper and proper radiographs should be taken and mark the tooth on the radiograph as well as the rubber dam as well as on the tooth to prevent the emergency. Then second is incomplete removal of caries. As we know, before endodontic procedure we have to remove the caries from the tooth, but in case of secondary caries or caries below the restoration, sometimes the caries may left inside the tooth and may leads to the incomplete removal. So the proper excess opening should be done to prevent this infection. Then third is inability to locate extra canals. If the clinician is not able to locate MB2 canals or the extra canal because of lack of knowledge, or if the deroofing of the pulp chamber is incomplete, or if the deroofing is not proper, then this emergency can occur. So how to prevent it? Take the IOPA to locate the extra canal and always locate the extra canal with DG16 Explorer and know the anatomy of the canal. Then fourth is cervical or iatrogenic perforation. Cervical perforation can occur because of lack of clinical knowledge, or if the crown root is at angulation, or if there is crowding of the tooth. Cervical perforation should be located after the stoppage of bleeding and then stored the tooth with the MTA. Now coming to the emergency related to canal shaping and cleaning. So the first emergency can occur is canal blockage, then deviation from the root canal, then the separation of the instrument, then strip perforation. Canal blockage can occur due to inadvertent dentinal chips inside the canal. So the proper cleaning and irrigation should be done. Deviation from the root canal, there are three things can be happen: ledge formation, transportation of canal and zipping. To prevent the ledge formation, the recapitulation of the working line should be done. Work passively and do not and never force the file into the canal. Then for transportation can occur if the root apex is moved at the different location. So recapitulation is mandatory and use the smaller file first and then the larger file. Then zipping, Zipping can cause apical transformation of the curved canal. For this, always pre-curve the instrument before using. Then third is the separation of the instrument. To prevent it, never force the instrument in the canal and irrigate the canal, and cleaning should be done. First the small file should be used and then the larger file should be used. Strip perforation can occur during the cleaning, and the treatment is block it with the help of mineral trioxide aggregate. Then during obturation, endodontic emergency can occur. First is underfilling and then the overfilling. Underfilling of GP can occur if there is loss of working length, whereas overfilling can be done if there is over preparation of the canal. We can prevent it by having the proper knowledge of the working length or proper knowledge of the anatomy. Take the working length of the IOPA and use accordingly. For under and over obturation, do the root canal treatment again.